So good afternoon. My name is Jamilah Lemieux. I'm so excited to join my friends from NewsOne and moderate what I think is going to be an incredible conversation with some of our leading thinkers, doers, artists, change makers about what is an unprecedented time for all of us. And that is, of course, the COVID-19 pandemic. And today we're talking about the intersection of race, art, social justice, and medicine. NewsOne has partnered with the Brotherhood Sister Soul, a powerful social justice youth development organization that is celebrating its 25th year of work in 2020. And they regularly curate powerful conversations like this throughout the year. And so what we want this to feel like is like you're listening in on a group of folks chatting over an intimate dinner or lunch situation. This isn't formal. This isn't even the sort of panel that you would go see at a museum. This is very much a family conversation because we are family. And I think now more than ever, we need to remember that and treat each other as such. So to give my a little brief introduction of myself, I'm Jamilah Lemieux. I'm a writer and cultural critic and consultant. My work has been featured in a whole bunch of publications. Happy to be a writer and proud to be a writer. And being a writer is more difficult at this moment in history than it's been in any other time in my career. And I would imagine that the folks that we're going to talk to can tell you the same when it comes to producing the sort of work that they do, that this is an unknown, that even those of us who are incredibly cynical, who are incredibly astute when it comes to observing the current state of the world, and those of us who are students of history, that this period in time is not something that most of us saw coming. And so we are very fortunate to have such a great group of voices to help us make some sense of the madness and talk about how we are moving forward and how we will move forward. So with that, I'm going to introduce our panelists, and then we're going to watch a brief video about the work of Brotherhood Sister Soul. So you can, for those of you who aren't privileged to be familiar with their great work, you too can become a fan of the phenomenal things that they're doing. So we have Khary Lazarre-White, who is the co-founder and executive director of the Brotherhood Sister Soul. He's also a novelist, an organizer, social entrepreneur, and attorney. Again, he's the executive director and co-founder of the Brotherhood Sister Soul. We have the Carrie Mae Weems, who I'm trying so hard not to fangirl right now, but I might be blushing just a little bit because I'm that excited. She is, of course, one of the most influential contemporary American artists of our time. Her work is internationally celebrated, and it investigates family relationships, cultural identity, sexism, classism, political systems, and the consequences of power. We are truly in the presence of giants today. We are also joined by Bill T. Jones, who is the artistic director, co-founder, and choreographer at the Bill T. Jones and Arnie Zane Company, as well as the artistic director of New York Live Arts. He is a Tony Award-winning, multi-talented artist, choreographer, dancer, theater director, and writer. And last but certainly not least, we are joined by Dr. Aletha Maybank. She is the inaugural Chief Health Equity Officer and Group Vice President at the American Medical Association, as well as a nationally recognized speaker and advisor on issues related to health equity, the future of medicine, and public health impact. So thank you all so much for joining us today, family. I appreciate each and every one of you and have for many years. And before we get this conversation started, we are going to see a video about the work of Brotherhood Sister Soul. And we will have that for you in just a second. see. Okay, Dee, are we
Yeah,
good with the video?
Give me 1 second. Sorry about that.
Okay, I'm sorry. So while we wait for the heads up that the video is all ready to go, just a brief check-in. How's everyone feeling today?
Oh, wonderful. And I'm really excited to be here with you all. As much as I don't like computers, Zooms, meetings, but I'm really enjoying the sort of connection that we're able to one another and to see one another. I think it's really important. So thank you for the opportunity.
Well, I was just saying to the group before that I feel totally Zoomed. This is my third Zoom or fourth Zoom conversation today. I'm on the East Coast. I didn't know that life was made of so many meetings. Now I guess without the travel in between, I can feel the meetings themselves. But I feel very 21st century. I've been sort of forced to deal with this technology, and I'm learning. And of course, this is very close to my heart. Sister Soul is a very important organization, and I'm so glad to be in contact with them. So I'm feeling pretty good.
Yeah, I would echo Carrie and Bill. I also just feel like it's wonderful to connect with people in this time, this time of social distancing. It's such a bizarre phrase when you really think about it. We're social creatures who need connection and love and human touch, as Bill was talking about earlier. And the fact that we can come together and at least see one another's faces, all folks that I care about on this Zoom and know and connect and talk about art and talk about a way forward. I just feel like it's, it's sustenance for the soul. So I'm looking forward to talking with you all today.
All right, we are ready to go. I'm about to start the video.
Okay, good. Dr. Maybank, before the video starts, how are you feeling today?
I'm good. I'm a little busy, but I'm good. So no worries. Thank you.
At Bro Sis, our young people come together to define what it means to be a woman, what it means to be a man. The young people pledge to live up to these definitions. And this moral and ethical code is what inspires and connects all our youth.
What does it mean to be a man?
What does it mean to be a woman?
To be a man, you need to be strong, accountable, caring.
A man is always responsible. A man is always brave. A man is always vulnerable.
A woman is someone who is knowledgeable, passionate,
Unapologetic, resilient,
tenacious, responsible, optimistic, compassionate, and smart.
What I learned at Bro Sis was that being a man isn't all being all macho, and it's more so about just being comfortable with yourself.
A man to me means one that respects everyone. Most importantly,
Did we lose our connection?
one that respects his kids.
To be a man, you have to be open about your feelings.
Being a man is thinking about the people that you love and taking care of them.
Where I'm from, we don't have a lot of men. We have drug dealers, people that can make crime, and we have a lot of fathers that don't clean their kids. I want to be a man. I want to be different. I want my kids to grow up with my affection. I don't want to do wrong. I want to break the cycle of my family.
At Bro Sis, I learned that I want to be a woman who has integrity, confidence, and has respect for other women and myself.
I want to be a woman who's inspiring, powerful, passionate, and badass.
I want to be a woman who leads.
I want to be the person who stands up for people who are not heard.
I would like to be a man who claims his own definition of what it is to be a man, not what society paints it to be.
I want to be a man that's gentle and strong.
I want to be a man who respects women in all ways.
I want to be a woman who lives in a moral and ethical way.
I want to be a woman who claims my body as my own.
I want to be someone who speaks up even when my voice shakes.
In the future, I will use my voice to speak for those who may feel as though they are voiceless.
I will use my voice to take care of my planet.
I will use my voice to motivate others.
I will use my voice to disrupt the misuse of power and empower my Black and Brown community.
I will use my voice to unify people to make the world a better place.
This is the world Grossist envisions, one based on our themes of positivity, knowledge, community, and future.
Bravo, bravo.
Awesome. Congratulations to you, Khary, on 25 years. That's incredible.
Back in the 40s.
Thank you. Thank you very much. It's been a wonderful 25 years.
Involves new apartments or.
Okay, so I think we're good to get going.
Get started. That's right.
Let's get started. I'd like to start with you, Carrie Mae. In your bio, it reads that you've spent your career, quote, investigating family relationships, cultural identities, sexism, class, political systems, and the consequences of power, unquote. How does that show up for you in this moment? How does that work inform your perspective on the pandemic that we're experiencing right now?
Wow, starting with me. In a way, I wanted to really start with Dr. Maybank because her perspective on the moment is something that I'm so anxious to hear, but really, we've been due for a correction. And the correction has been coming for a long time. I don't know exactly how it was going to come, what the terms and the way it was going to come, right? But we've been involved in this sort of method of deconstruction and looking closely and critically for a very long time. And I know I have, Bill has, right? We've been in this thing, unpacking this thing and working through it, through our various means. And so in a lot of ways, nothing has really ultimately changed, except that things have all been shifted, opened, cracked, and spotlighted, right? Spotlighted, I think, in a really sort of extraordinary way. For instance, Dr. Maybank, there have been any number of rumors circulating amongst the Black and Brown community.
Absolutely.
This virus. And at the same moment, we are the people that are being most impacted by the virus and are dying in greater numbers, right?
Right.
So bringing that to bear, bringing those ideas to bear, right, on the moment, right, really using the language and these ideas to really crystallize, really finally, that we have been under consistent assault for centuries.
Yeah.
Right? And now the world can look at what is going on around the question of brown people and their experience in one of the greatest countries in the world, right? We are under systematic attack, and this is one of the ways in which we can understand what is happening to Black people, right? The underlying health conditions, the stress conditions, levels of depression, levels of all of those things are brought to bear when this sort of virus, this pandemic has descended not upon just Black people, but upon the world, and yet we are the people that are feeling it most acutely. And I think that that's really something finally that's really important that we've been talking about for years, and now we have all of the sort of laser focus on this, and I think it's absolutely imperative. Very excited. I am energized. And I get up every morning and I come to my studio and I work on this problem.
For you, what does working on this problem look like?
Well, I'm working on graphics, I've actually built a public arts campaign. I've built a public arts campaign with my own energy, my own ideas, my own work, my own language. And now Khary's young people are helping me develop my PSAs to sort of push those out into the public. But we're doing billboards and flyers and posters, giveaways, shopping bags, but all of it, of course, related to text. And I just have, if you don't mind, just a couple of images here.
Of course.
Share with the group. I hope that I'm able to share them with the group.
If we don't mind, Carrie Mae Weems, please.
It's just, just work it. Can you see my screen?
Not yet.
Not yet.
Just see you.
Okay, so you can't see me.
Let's see.
No, we still see you, Carrie.
Yeah.
Click the green share screen button.
Moment, but I am working on a public art project that will launch in about a week and a half. I have buttons that say COVID-19 is not a hoax. I have shopping bags that thank the workers, the butcher, the plumber, the clerk, the farm worker, billboards that say, of course, all life matters. My only point is that Blacks are dying in significant numbers, sadly, and things like that, to simply encourage a number of levels of conversation and idea around the problem that we are currently facing. But I think that, of course, historically, my work has always really tried to speak to the moment in which we live. And so to that extent, really no different.
Thank you. I think that something that you touch upon, Carrie Mae, that is so critical for our people in this moment is there's a trust that we have in our artists, that we've long been able to have, that we've been able to look at our creators and our creatives for information and for answers in ways that we can't always look to our elected officials, that we can't always look to certain members of the medical community because there's this deep distrust, that quite naturally results from years of abuse and neglect. And so I do want to bring in Dr. Maybank now and ask about that intersection of race and class. I think many of us, at the very least have a vague idea as to why when white folks catch a cold, black folks catch the flu,
pneumonia,
right? And we die. But if you could speak to, give some specific information as to why there's just such a disproportionate number of our people who are not surviving COVID-19, and what should the medical and public health responses to this moment as it relates to Black folks look like, and why aren't we seeing that?
Yeah, so one, thanks for Khary for the invitation on this amazing panel. And I want to kind of echo something that Carrie Mae said in terms of the years of, fighting this fight, right? Trying to open these doors, dismantle these structures, and figure out how do we reconstruct new ones. And for those of us who have been in the healthcare side or the public health side, who have been in the justice arm of it, we have been kind of, screaming from the top of our lungs, for a long time, and even from the time of, honestly, E.B. Du Bois in the early 1900s, that the conditions of which people live in, and particularly Black people, are contributing to their health in oftentimes not very healthful ways or productive ways. And that there is the context of what we understand about our history of having a racialized capitalist system, and the opportunity that happens as we structure through laws and policies, opportunity as well as the assigning of value that also doesn't support people, right? And when it comes to health, I think there is a really important context to really understand in terms of the barrier of being able to move this conversation forward, and why we've had to kind of continually, push and push and push as doctors who are in the health justice space. And part of it is that people really don't understand that race is a social and political construct. and that there is not much biological, genetic, behavioral basis for race and for the differences that exist. So that's a huge hurdle, to overcome, because folks will hear, well, it's about genetics and it's about, the way people behave, and it's all, rooted in that. And I think it speaks to a larger disconnection about what creates health in the first place. And that there's so much focus on like the healthcare side, and it's all about having access to insurance, which is absolutely important. But we all, especially on this call, understand, that jobs and opportunities to build wealth, transportation, food quality, where you have a home, if you have a home, all also impact health. And so these differences that we see that are racialized are, they're not by coincidence, they're not just consequence, they didn't just happen, but they were produced. And when we look to see like who's more likely to get sick, who's more severely likely to get sick, it is people of color, because we have lived through times of where there's been continual disinvestment at the neighborhood level. We've been deprived of good paying jobs, consistent employment, increased opportunities to build wealth, lack of consistent transportation, and more likely to have to rely on public transportation. So more of us are literally on the front lines working at a day-to-day basis. And this isn't even talked about as much, I don't think, as essential workers, and how that exposes and increases the exposure, to COVID. And all of those things within our environment create stress. I mean, Carrie Mae kind of elevated earlier, and we had some pre-conversation about just the stress of this all, and that causes weathering over time on the body. And then when we look at those who are dying, we're very clear, and folks have heard this, of the underlying conditions. Again, disease has been racialized, so we're more likely to die of like diabetes and heart disease, and have hypertension. And those things put us at more risk to suffer from severe complications of COVID. But we have to be very careful to not just leave it to the underlying conditions, and contextualize to the historical context, the structural context, and the social context, or else we leave the space in where the way messages are delivered, the way headlines happen, that Black people are to blame, that Black people are the risk factor, right? And that race is the risk factor, when really it's the system and the structures of racism. And it's really important when it comes to times of putting solutions forward, whether it's in the healthcare side or the public health side. I would say in terms of, the question around, what is happening with our response? I mean, there are many things that are happening at this particular time that's not advantageous to really most people across this country. We're very clear in this country, our health system, our health care system, so our sick system. So when you go to the hospital, you see a doctor, as compared to the public health system, that is somewhat invisible, but really takes care of a lot, focuses on immunizations, helps make sure restaurants are safe and sanitation is happening. Those systems are very important, but they're not very much integrated, or they don't come together on a normal basis. And so we're really seeing during this time what this divide creates. And it just creates a lack of coordination and communication between two very important parts of keeping our society well. And then in addition to that, the public health system has been underfunded. And because of it was kind of mentioned a little bit earlier, implied, our leadership at this time at the national level, we lack a coordination of like a whole public health response. We've gone through, we've had Ebola, we've had Zika, we've had H1N1, and the CDC has been able to step up and do what they needed to do, and help coordinate the states across the country. But we have a severe crisis in leadership at this time, and it's creating a tremendous gap. And those who are most impacted are absolutely us as African Americans, as well as Native Americans as well, who have the history of genocide and being dispossessed of their lands as well, historically.
Dr. Maybank, something that I guess would fall under the social part of this, and something we'll never be able to adequately measure, is that when studies have shown that there are a number of medical professionals who believe that Black people, Latinx people have higher pain thresholds, or that they don't take our symptoms seriously when they're present, and don't take our words seriously when we say we're hurting, this headache won't go away, I'm not feeling well. And that's something that has finally started to penetrate the headlines with the talk about the Black maternal health crisis in recent years. How many Black women have lost their babies or lost their lives despite doing everything that they were supposed to do in terms of engaging a doctor and asking for help and saying something's not right and not being believed. There was a woman in Brooklyn who passed away a few weeks ago after being denied a test for COVID on at least 3 occasions, one of which she was suspected of having a panic attack. And so I think I speak for a lot of us when I say that's the thing that keeps me up at night, not just the possibility that I could have, that I could get this and that I could get sick, but that I could get this, I could get sick. I have health insurance, I could go to the hospital, I can go to a good doctor and still not be treated or seen as a priority. If that's the case on a good day, that now we have doctors that are making quote unquote difficult decisions, who've gone through the trauma of losing colleagues and losing more patients than they usually lose. And they're showing up, not their best selves because they're hurting. And if this is somebody who's already inclined to look at me and not see somebody who's in need of care, is there anything that you would suggest that we can do if we find ourselves having to engage with the hospital system right now because we believe that we have COVID-19 or we do have it, to at least try and ensure that we get the sort of care we deserve? Is there some language that we should use? Because I've given the Black Women Die in ER speech at the hospital many times.
Yep. Yeah, exactly. We all have, right? And not we all have, but many of us have, I think, in that same way. And, even as a physician, I have those same fears for myself and for my family, because the reality is that the history tells us, whether the history that we've collected, and there's a lot of evidence, on the science side of it, we have tons of studies that show that, one, there are physician biases. There are biases, as you already related, rooted in pain, beliefs about blood and the thinness or thickness of blood, beliefs about, do we have extra muscles in our body? All these narratives that really prevent advancing equity and advancing justice as it relates in health. And it puts us in a place of, wanting to be able to protect ourselves and be able to protect our families. And this is a story that translates across, I think, several incidents that are happening right now when we think of brutality by police and other hate crimes that are happening. But wanting to kind of put our best foot forward, going to the system and totally getting pushback. And what do we do during these times? And what I usually say is, if you have a doctor, if you have a healthcare professional, make sure that you are in contact with them very closely and very intimately. I think in times like these, as we all know, we have to be somewhat of our best advocates, and our best advocates for one another as well. I think part of, we talked a little bit about myths earlier, we have to make sure that dispel those myths, because I think that does keep us home as well at times. But at the same time, we need to make sure we're in communication with one another so that we can communicate when we're having problems, when we're not able to access systems, so that we can figure out collectively and as families, how do we approach the situation? And this has happened to me actually pretty recently, of kind of coming together as a family, making sure that we're communicating and that we're advocating in different ways together with this information. But this is where I think the intersection of art becomes really important. There is a hashtag, I think it's Black Health Now, and they are starting to document and collect stories of folks and their experience. And what I've learned, from being in health for so long, is that numbers, are great for institutions at times. They may move institutions, but they don't necessarily move policymakers. They don't move people into action because they don't really connect to emotion. But our stories and our ability to be able to tell them, to highlight them, to show them, does help push at times, not all times. I'm clear we still have challenges, But I think there are creative ways of which we can tell our stories during this time of COVID to elevate that we are experiencing injustice. Our families are going to the hospitals and they're not getting responded to, and we're told to go back home. And I think the more and more we can elevate those platforms are critical. And for me, from the healthcare community, I think it's really important that we start to partner with folks that are artists, you know, and that we tap into the talents and strengths of all aspects of our communities in order to have a better collective voice and a more powerful collective voice instead of, you know, being separate. That's why I really value this call to be on with artists, you know, to kind of think forward, like how can we work together to elevate injustice?
Thank you. Khary, can you talk about the work that Brotherhood Sister Soul is doing to respond to this moment?
Brotherhood Sister Soul is a comprehensive youth development organization. We do everything through the lens of social justice. We were founded 25 years ago because we saw the need to support Black and brown young people in Harlem. It grew to the South Bronx, serves young people in Brooklyn and Queens as well. But it's a wraparound comprehensive youth development organization. We do international study in Africa and Latin America. We do after school care. We do intensive arts-based education, environmental education, lots of college guidance. We also have protective services like legal representation and mental health support. We are comprehensive in nature because, you know, so much of what Aletha and Carrie Mae have mentioned already are the negative forces allayed against our young people, the historic realities that our young people are forced to endure. And so we realized that our response had to be comprehensive in its own right. And so we proudly take on the mantle of a social justice organization. At best, we want to do the current day work of SNCC, of, you know, kind of political organizing of young people so that they can be change makers. And so that's the first piece of what we do. The second is that we train educators across the nation and internationally on our model, and we've had formal programming in Brazil and Bermuda and other places. And then the third is that we work around the issues, organizing and activating around the issues that are so key to our young people. So we have worked to reform stop and frisk in this city, which was an unconstitutional racist policy under 2 administrations. Our young people's voices being at the forefront of that, creating art, writing op-eds, leading chants, leading demonstrations, being named witnesses and litigants to change that policy. Our young people have also organized to shut Rikers Island, a long struggle that we are slowly winning and hopefully will win one day, taking on inequities in the criminal justice system, around disparate enforcement around marijuana. We have, you know, lots of white-owned companies making billions of dollars in the Midwest and West over the marijuana industry, and we have hundreds of thousands of Black and brown people still in prison because of marijuana. And so our young people raising awareness around that. And so what our work was pre-COVID, just 8 weeks ago, 10 weeks ago, was comprehensive youth development work, training of the field, and this organizing and activism work. And what we realized was, you know, as soon as this crisis occurred, that our young people, unfortunately, coming from economically distressed Black and brown communities, would catch hell. And so their parents were the first to lose jobs, low wage, blue collar jobs, frontline, working in stores, working in restaurants, cleaning people's houses, you know, folks who were doing the kind of day-to-day difficult work that Black and brown people have had to do in this country, you know, for so long, are the jobs of so many of our members' parents. And so they lost employment. And so in turn, our young people were immediately food insecure. They immediately didn't have access to healthcare. They immediately were concerned about their rent. I mean, this is a tough enough time to wake up in the morning and to have this reality that all of us wake up with. But imagine waking up in the morning and not knowing if you have a roof over your head. Imagine waking up in the morning and being homeless. 10% of all children in the New York City public school system, over 100,000 children are homeless. You know, just pause on that for a second. 100,000 children in this city are homeless. So those are young people we serve. So what does it do to your psyche? What kind of trauma is that? And so we realized we needed to respond comprehensively. And so we increased the amount of mental health support and guidance that we could supply our young people. We moved all of our services remote. And so our young people are receiving mentoring, tutoring, mental health support, guidance from our staff, our incredible dedicated staff on a daily basis. we knew that our young people needed access to technology. So like Bill, I'm a bit tired of Zoom meetings, but at least we have the ability to connect face to face. And many of our young people didn't have the hardware, they didn't have computers, they didn't have Wi-Fi, they didn't have the jobs anymore that allowed them to keep their phones active. So we had to provide emergency financial support, coming up on $50,000 to assorted members and their families to pay key bills. We had to distribute computers and hotspots. But the most intense need was around food. And so in a normal year, Grossist provides almost 12,000 meals a year. And that's breakfast and lunch and the regular ongoing realities of our programming. We have provided 15,000 meals in the last 6 weeks. We have had to distribute huge amounts of bags of groceries to our young people. We have had to distribute fresh produce and milk and eggs. We just last week provided 285 families with food for the next 2 weeks. The reality is that we're going to do that because we're a social justice organization. We're going to do that because we are innovative and independent. But just for a second, I want to pause on why we have to do this. And this really speaks to Carrie Mae's point about something being cracked open. You know, this is a country which continues to allow profound, gross, horrific inequality to exist because of race and because of class. And so people do not have access to a livable wage. People do not have access to healthy food. People do not have access to healthcare. And so people are already teetering on the edge. That's the population we serve. And what this did was push people over the edge. But what we can't do is just look at COVID in its own vacuum. We have to realize what this really is a question about America, what this country is going to be if we're going to finally come to terms with the horrific racial and class history in this country. And that's what this time reveals. And so we're stepping into that space to serve our young people, but we're also constantly elevating the conversation of what really is going on in this nation that necessitates the work that we're all doing, whether it's the artistic work or the work in the medical field. And so, you know, that's an overall kind of overarching description of what we do and what we need to do. And then I think going forward, you know, we just have to reimagine what this country, what this city can look like. And I think it's a key role of artists. I think, you know, Bill and Carrie are two of the most iconic artists in our country. Their work has constantly investigated these themes, but also the spaces in between these themes. And I think that's what we need now. We need a conversation about reimagining what our country can look like.
I think that's a great time to bring you in, Bill.
Mm-hmm.
So much of your work has investigated those spaces between, you know, between race and gender and between gender and sexuality. How does your previous work inform your response to COVID? And how do you think your work will or has or will transform as a result of this moment?
Mm-hmm. Well, thank you for the question. You know, I'm here today wearing a couple of hats, and I will answer that question as an artist, an independent artist. Because as you know, I represent a very important downtown, that word means something in New York, downtown organization of independent artists. These are people who have decided they would like to commit the greatest sin in capitalism. They indulge in an activity which has very little market value. So like the Black and brown people that are in our audience, are in our community, and poor people everywhere, independent artists often have no safety net. And as Carrie said, and as Carrie said, the COVID has exposed a number of inadequacies in our culture. What do you do when people who perform a function, important function, art, what do you do with those people when they no longer have any safety net at all? COVID is asking us that question. My work goes all the way back to a time when I was a young, agitated performer on stage, belligerently staring at an audience that was primarily a white audience. And I am there and I'm trying to win, because that's one of the things we're taught. We are trying to win. We want people to love us. And at the same time, trying to show this belligerence as a state of mind about something that Carrie Mae was getting at, and she said something is cracked open. I was already from the beginning of my work there was something I'm not satisfied about. I thought it was my own psychological shortcomings, which I think that is true. All artists must look at that sacred and scary thing. But I was also trying to get people to say, listen, something is not right here. I am entertaining you. I am a sexual fantasy for you. I am the Black man, the Sidney Poitier for you. I am all those things, but there's something else going on here that is not correct. So that's the independent artist. New York Live Arts is trying to lead a charge right now in pulling together smaller experimental spaces across the board. And we're asking ourselves, how do we support artists? Let's think of artists as an underclass. How do people get paid? How do people get their, make sure they have food and their rents and so on? That's part of what our mission is. And we have a great staff led by Kim Cullen. And we are thinking about these issues right now. How do we reopen our theater? How do we get that economy, which is already always struggling, how do we get it back up and on its feet? The other thing that brought me here today was I came to Carrie the day that my sister, Jahari Briggs, sent me a very upset text message in which she accompanied it with a video. Now, maybe you've heard of this video. Young man in prison, mask on his face, and he has snuck a phone into his cell and he's saying, I don't want to offend anyone, but he said, they want us to die up in this bitch. Who is they? And they want us to die. Now, so in our conversation right now, all successful people, and I dare say successful middle-class people, how are we feeling about what he was saying? Now, first of all, was the tape for real? Because people tell me, oh, it might have been a hoax, because it's very difficult to find it. He points to the man across the room from him and said, that dude is dying. And he said, the white boy in the bed above me is dying. And he points to a tent out in the basketball court, and so they're putting bodies in there. He said, don't y'all forget us. Do what you have to do. And that's when I came to Carrie, who is our new partner, Grosis, and said, what can we do? And that's when we had the idea of bringing Carrie Mae, and we wanted a medical professional. So to help us separate fact from fiction. We know that racism is endemic. Is this COVID unfairly, I think it's been said, targeting the most vulnerable people? And what can we do about that? When somebody is in jail and they cannot social distance, how do you feel about the fact that you have in fact sentenced them to death? What can we do? This is the question. Is social distancing a privilege? How many people can afford to social distance? And if you cannot, what is my relationship? Let's talk about personally. As a middle-class Black man, successful artist, what's my relationship to those people? Do I have one? That's what this talk means for me today. Yes, I'm representing a community of fierce, independent artists in Manhattan, Brooklyn, all the boroughs. But I'm also here to ask the truth of us. How are we feeling about our own complicity in, are these the forgotten people? What is prison a dirty secret? And there are other dirty secrets. Why is it that so many, I think I'd like to talk about this with Dr. Maybank, for instance. I feel my companion, my husband, went into New York for the first time the other day. We've been nine weeks up here. And he said it was amazing. But he said, you know, a strange thing was most of the people I saw who were not wearing masks were people of color. Can we talk about that? Is it two sets of information? What is it? Why do some of us feel uninvested in what the science is telling us? I'd really like to hear from Dr. Maybank. So I'd like to come back, of course, because I can never talk too much, but I think I would like to give the floor to Dr. Maybank, if that's okay. What is this? What is this blindness? What is this? Who is invisible and who is not listening?
Yeah, there's so much as you go through this. It goes on for me. You know, there's a real talk conversation that I want to have in a second as well, to the point of who we are in this panel and on this call in terms of our own kind of position in society and our middle classness, and what does that mean? And also for me, you know, I'm in a structure, I'm in a historically white institutions. A lot of institutions in this country are, right?
Mhm.
So, you know, the work that I'm trying to lead and the voice and the advocacy that I'm trying to do, you know, it's landing in one way, but the reality is, from doing this for a long time, if it really landed, you know, we would have systems and structures that would respond to folks like me who are doing this work. And there is a level of, in terms of personally, exhaustion, of having to, you know, constantly put forward what is happening within our communities, and sometimes it not falling on deaf ears, sometimes it falling on silence, sometimes it falling on inaction. I've been fortunate to have a lot of support in my institution, but to be real, those who are in this power of having, you know, money and decision-making power around systems such as prisons, systems such as healthcare, are not proximate to the people. They're not proximate to the experience of Blackness. And it creates a tremendous barrier to explain what's happening, you know, in its fullness. And it's not even fair. I can't say that I show up, you know, I don't represent every Black person in this country, right? But that's what starts to happen when you get into kind of these roles in these spaces, to, you know, be this go-between between this power structure and then what's really happening, you know, at the realities, you know, of communities. So as I'm listening here, I'm thinking through, you know, so what makes an opportunity that the stories and the voices, the experience, you know, becomes proximate to those who have that level of power and decision-making power and money to dictate oftentimes what happens to us in our communities and to our friends and families. That's kind of where I'm at as I'm listening to you talk. And, you know, I have this privilege to hear many different folks' stories, their experience. It's my family's experience. I'm Black, you know, you know, and interesting, not even interesting. I don't know if that's the right word to use it for it. You know, I had somebody die that was close to me, and I'm like the only Black person in the senior leadership, and I was one of the only folks who had somebody who died close to me, and other people die, you know, as a Black person. And it's just so obvious, you know, of the disparity and the difference. And it's so obvious sometimes, a lot of times, of the difficulty to kind of translate, to say, this is what it looks like. This is what, you know, somebody's humanity looks like. This is the experience that we go through on a day-to-day basis. And I'm here with them all, you know, sitting at the same level, but how to make somebody value another human being, that to me is the question. Like, you know, we can say we need to affirm humanity and that needs to happen and systems need to happen, but how do you make somebody value somebody else that's not of their own? And you, well, as you said, I think Carrie Mae said you don't. I can't fully tell because it's on mute, but that's the question, because I can bring it up, you know, oftentimes of the complexities that are happening, but it doesn't always, people don't always respond. And so that's where I'm at.
So doctor, why are certain people not listening? Why are certain people not listening, or they feel like the message is not for them?
Several things. I think one, we have, and this is before COVID, we already have a history, and this is very rooted in our history and context of slavery, of fatalism, that, you know, well, we're going to die of something anyway, potentially. So, you know, what's the point of it? Two, I think there is, even outside of that, a sense of mistrust. You know, is this information really accurate? You know, is it helpful for me? Maybe it's helpful for them, but might not be helpful for me as a Black person. And I think there's just misinformation as well. I think there are many channels of communication that I'm not even aware of, but I have heard, you know, different either mis or miscommunications that just are not accurate information, and people really don't know what to do and when to do it. And then the other piece of it that I think happens is we have kind of all or nothing messages. So the context of stay at home, I think a lot of us get the importance of it, and it's definitely helped flatten the curve. But a straight out to stay at home message without any nuance to the realities of people's lives, as you mentioned already, in terms of, if you have to go to work, right? And you have to come back home. What does a stay at home message mean? What does a social distancing message mean? If we're Black people who are more likely to have people to die, that means, one, we're probably caring for people more often. So we have to be close to people in order to care for them, and when we go in and out of our homes, we have to figure out how do we protect other people as well within our homes. So there are all these nuances in communication that really didn't happen with our messaging. And I think that has been really challenging for us as Black community. I don't feel it's always a total disconnect that folks don't want to protect themselves and they don't want to take care of themselves and their family. I think there are so many missed messages and not enough nuance in the messaging that lands and feels relevant to folks.
There's something I wanted to read from quickly from an article that ran on the Tribe's website. And the Tribe, it's the TRIIBE, Tribe with 2 I's. It's a platform run by Black millennials in Chicago. They're doing really phenomenal journalism on the culture, the news, just things that are happening in the city of Chicago through a lens that's often ignored and flattened by narratives of quote unquote Chirac and young people who just simply don't want to do better or can't do better without much regard to how they've been systemically and historically let down by their city. And I'm a Chicago native myself. There was a party that went viral, or there was footage from a party that went viral a few weeks ago. TMZ reported that there were about 1,000 people at this house party, which attendees said that was an exaggeration, but there were some 50 people who were arrested. Mayor Lori Lightfoot, of course, spoke out about, people who were there not getting the message. And that makes me think of what you said, Dr. Maybank, about the messages not always being nuanced enough. So if I work at a grocery store and my job is essential, if you're saying stay home, save lives, what am I taking from that? Am I to understand that my life is disposable?
Yep.
If my job is not going to give me proper protection, or that, I simply have to show up to work because people have to eat, but I'm not paid like somebody who's doing critical work, right? Like a lot of people in the medical profession are well paid and a lot of people are not, right? But we know that retail workers that have been deemed essential, and sanitation workers and bus drivers and people that are doing work that is putting them at constant risk because they have to continue to engage with other people. So, a good majority of them are not well compensated from this work and are not getting the sort of cheering and support that we've even pretended to give to doctors and nurses. Yeah. And so Illinois State Rep LaShawn Ford raised some questions that I thought were important for us to consider when we're looking at groups of young people gathering together for a party or playing games of basketball or just continuing to function somewhat as normal without masks and without, participating in social distancing to the extent that they can. And it's, he said, these are the same people who've been disrespected by the government, by the police, by the school system that they attend. And now we're saying we expect them to do better now that we failed them. And I think that when you have young people who've been told, and I pardon me for forgetting which one of you all mentioned this, but that the problem is us. So it's not what's been done to us. It's not the conditions under which we're born, that something is inherently deficient about who we are and how we're born into this world. And because of that, we can't be saved. And that there are so many young people that feel that they're essentially, and this was the quote from Ford that I was looking for, the youth in Chicago are all traumatized. Young people in Chicago don't feel that they'll live past the moment, and so they live for the day. Mm-hmm. And I think that what we're observing is a lot of people in this moment that are continuing to live for the day because the institutions that are telling them to do something different have historically not given them information that has made their lives better. you know, or safer, or happier, or healthier in any way.
There are so many issues that are related to going back to Kari's, wonderful description of the work that you're doing. That I'm so deeply proud of. Proud to be associated with someone so thoughtful who has really considered and engaged in this particular way, because I know even with all the love and all the compassion, I know how difficult the work is, and yet how important it is for the work to be done. And so I think there are any number of messages that circulate. And one of the things that I think that we really don't talk enough about, that I think is really crucial, and Bill, yes, we've all come from, I come from a farming family, working class family. And now I have my big house, my big back porch is all beautiful. But I've never forgotten who I am and where I come from, in the value of what has been given to me to do the work, right? This particular voice, this particular way of speaking, this particular way of moving, this particular way of making work to present in the world. I am deeply rooted in where I've come from, regardless of my middle classness. It gives me a certain privilege, but I'm steeped in the awareness by constantly being with my colleagues, my friends, my family, my nephews who are in and out of prison, my friends who are in and out of work, my friends who are in senior homes, afraid that they're not going to make it. Issues of class that are very, very, very deep. It's not just a matter of not caring. These people are going outside. Essential workers are going. I did a piece with my mother last week who said, I always knew I was essential. I'm so glad you know it now too. Right? And so people are going outside of their homes. They've got to go to work, working class people, and they're using bleach on their skin and Lysol on their skin, or they're eating multiple cloves of garlic, home remedies, right? No health care, right? No health benefits. What is going to keep me safe from the moment I leave this home and I make it back home in the evening, right? So there are a whole set of home remedies that people have come up with in order to make it through the day and to make it back. Some people don't have enough money to get on a bus, let alone wear a mask, right? Some people, right? People are we're trying to give away masks so that people can wear them because people are stressed. People are economically stressed. And so there are many, many factors that are at risk, absolutely. There is some nihilism, but a lot of it is just people trying to make it through with very little means of making it through. And so I think, what I'm trying to do, what I'm trying to figure out how to do, and all of the work that I'm building, and I think I'm not dissimilar to yours at all, are what are the layers? What are the layers of meaning, of profundity that we have to deal with and to negotiate that runs through? What are the threads that are running through, right? Where we can start to make these connections between history and now and future, right? And culture and class and history and social dynamics, right? What are all of those factors? And then how do you blend them into a work, whether it be a choreographed piece or a film or a video or a poem or whatever it is, right? In terms of your artistic practice or your activism, whatever it is, how do you build on all of these sort of complicated connections? Because I think that one of the most important things that we do as artists who are rooted in ourselves and rooted in our culture is to figure out the complex ways that we can tell our complex story, right? It is beyond difference in pathology. It is much more than that, right? That doesn't begin to touch who we are, this difference in pathology that Dr. Maybank has been talking about, right? Much more that I need to consider. And so how do I use my voice? I'm constantly asking myself that question in order to build new references, new modes of thinking, right? And giving, I think, also not only a kind of hope for my audience, but a hope for me, right?
Mm-hmm.
I'm starting with me each and every day. I have to deal with this thing first, right? To know what this thing is. And then I can start to figure out how to give it out, how to shape it for the rest of the world. But I'm in here tussling with me and tussling with the meaning of what it means to be alive in this historical time, in this moment, of what it means to be Black, what it means to be a woman, what it means to be aging, all of those things. And I'm having, even with all the difficulty, I'm having a great time.
Well, Carrie,
go ahead, Bill. Yeah, I was going to respond to something Carrie said.
Please go.
I think, pre-COVID, I'm reading more public health articles than I ever thought I would read as of late. I'm trying to catch up to Dr. Maybank. I got a long way to go, but I recently, read this public health article, and, it was talking about disparities around lifetime expectancy. I mean, we're talking about COVID specifically, but, let's play that out. I think it goes to this issue of how people are looking at their lives. I live in Harlem. I'm born and raised in this city. 3 generations of my family have lived in Harlem. The lifetime expectancy in central Harlem is 70. The lifetime expectancy 2 miles away on the Upper East Side is 90 years old. So there's a 20-year difference in life expectancy within 2 miles in New York City. That is because of all the conditions that Aletha talked about, yes, but it's also about the history of this country that produced that and the current realities that we're facing. We know that there's a madman in the White House. We know that. But let's put that to the side for a second. We have successive administrations, governors, mayors, that have not dealt with these issues. We have recent presidents who were Democratic who did not deal with these issues. The fact that the prison system, to your point, Bill, has increased 400% in the last 40 years is a decision of policy, of otherizing people, that this is okay to put people in cages. 2 million people in this country in cages is allowable. It's okay. And we all of us in society stood by and allowed that to continue. I don't mean us individually. I don't mean that organizers didn't do things. I don't mean artists, but I mean society is responsible for that. I mentioned earlier that 100,000 children are homeless in the New York City school system. I mean, that should be on the front page of papers and news and websites every single day, and it's not. Mayors should be judged by it, and they're not. We have 5 members of our organization who've already lost parents to COVID, right? This issue of who is dying from this disease. One of my good friend's brothers just died, a Harlem resident, 38 years old, died of the disease. The realities of what we're facing today are long-term and entrenched. And so when we wonder why we're seeing this disparate impact, it is certainly about the current medical response to it that Dr. Maybank detailed. That is certainly a central part of it, but it's also part of a continuum in this country. I mean, I think often my father's side of the family is from North Carolina. 13 generations of his family were born into slavery in this country. 13 generations. 4 generations were born into segregation. My father lived in segregation until he was 25 years old. My brother and I are the first generation born legally free in our family. So if you talk about 17 generations of slavery and segregation and all of the racially disparate realities that come from that around health and housing and employment, all the things we know, all the ways Black people couldn't build wealth to change their lives. The GI Bill was for white people. Social Security was for white people. You know, all the ways that people were protected, were racially excluded. And now, just 2 generations post that reality, which you lived and came out of, Bill, in a very real and present way, now we see all this disparate death from a disease. And people are saying, why? Why is this happening? This is the country we're in. This is the reality. There's no other way it could have happened. There could be no other results. And so my point is, like, when we're working with our young people, the point for them to understand this history is not to be depressed by it, is not to feel that there's no other hope. The reason this conversation is framed around medicine, yes, but also around social justice and art, is that I believe art changes the conversation. I believe social justice makers change the conversation. That the way we frame this time, the way we speak to this time, the way we talk about inequity in this time can change the lived reality of people. I don't think it's separate. I think it can change medicine. I think it can change health outcomes. But the fact that, again, there's a 20-year disparity in a 2-mile difference from Harlem to the Upper East Side is a result of centuries and generations of reality, and COVID is revealing that. And I just think it's important that we always look at that historical reality when we're looking at the current modern manifestation of it.
Jameelah, may I ask this question of all of our panelists? Okay, that was very eloquent, Khary. Traditionally, you know, racism, that's the story of being Black in this country for the last few hundred years. We had the churches, we had unions, we had tight family unit. Now, how is Toni Morrison saying, beloved, they don't love your liver, they don't love your body. Okay, we got it. They don't love us. Then do we love us? And those institutions I just mentioned, where are they now? How are the churches doing around this? How are where are the other places traditionally, whatever that means, we would go to when white people wouldn't help us? Where are they? And how are they doing? How are we doing? Anybody want to take that up? Because I think we can, all day, we can sit here and say that the man, the evil white man, is at the root of everything. True enough. But how are we going to save ourselves? Anybody have any ideas about that? Where are those traditional places?
I would love for the panelists to take that on, but one thing I just wanted to add to your question, and of course, organizations like Brotherhood, Sister Soul have stepped up as we've always had organizations both outside and within the church that have stepped up on our behalf. But when, Khary mentioned that 5 or 6 of his staff members have lost parents, or have lost loved ones to COVID-19. And I think that what is not entirely unique to this situation compared to some of the other challenges that we faced at the hands of racism, but what is particularly striking about this one is that once again, we're confronted with ways that your middle classness, and middle class in this country is a complicated phrase, right? Because some people's middle class means owning land, having property, having places, having space, having savings. And for some people, it's simply the social circles you travel in, how you're able to dress, some of the books that you've read, that you're in proximity to class mobility, but that you're not actually class mobile, which means you don't have some of the power that comes with it, right? And that's a lot of us. But I think that that life expectancy for well-to-do Harlemites, I would imagine, is not so different, right, than you would think it should be, considering that these are people of means, right? That we've lost artists, we've lost people of means who are Black, we've lost politicians to this virus, right? People who are typically protected in certain ways. Maybe these are not the families that have to get on a bus on Saturday morning to visit loved ones on Rikers Island. Perhaps they have loved ones there they should be visiting, but say these are cousins or second cousins. This isn't, dad or your partner, right? So that you've been protected from some of the tragedies of our community in certain ways by having access to some capital. Now that's been stripped away in so many ways, that this is going to touch or is touching people, Black folks, across class lines, I think, in ways that a lot of other challenges haven't. And it's also begs the question, if the leaders of organizations, if people who typically are there to step up and say, we've got to organize, we've got to figure out how to help our people, are also deeply impacted either by losing loved ones, excuse me, or just the emotional trauma of not being able to leave the house, and not being able to have these meetings in person, of not being able to go to a grocery store comfortably, or to go, your kids are running. I have a 7-year-old. People's kids are at home from school. They've had to become teachers. That we now, with all the trauma and all the pain and all the things that we were carrying in these bodies before, have all of this foisted upon us. We know what they feel, but I do fear for how we have been, how we are being impeded in our ability to take care of and show up for ourselves in the ways that we have historically.
Yeah, I think, Bill, that historically, you know again better than any, that we have responded to every crisis that we have faced. And there's a long history of that being done internally and within the community. I think what's different about COVID and the response is that it is beyond the means of any one community. It is beyond the means of any one entity or philanthropy, for that matter. It is so massive and widespread what we're facing that the real danger of this time is what Aletha outlined at the beginning, that there is a lack of concerted, concentrated response to this from the federal government and across the country. It's the only way to really deal with it. And I think the reason we're confronting this is not a disconnection just in the Black community, but it's a disconnection in America right now. When we look at how many people do not vote, when we look at how many people are not involved in comprehensive response to the political system. The reality is, if people think that government doesn't matter, if people think that politics don't matter, and that is across racial lines when you look at who does not vote, then this moment right here shows how much that voting and politics and government matters. Government is the only thing that can respond comprehensively. We can support one another's soul and spirit. We can change messaging. We can be there in so many ways to support one another. But the comprehensive support has to come from government. And we are left right now with the most inept federal response that one could have ever imagined. And it's why we are in the level of crisis we're in. So I think we need to do work every day. And every day at Brotherhood Sister Soul, we try to do that work, and other organizations are trying to do it. But we also have to remove this administration and get a public health response and a medical response that allows for people to survive this. And it's terrifying that we are facing a crisis like this with the kind of people in positions of power that we currently have. And I think that is the crux of the problem right now, that it's so massive what we're facing that we need government response to deal with it.
I feel that right now I'm losing faith in so much. I'm gaining faith, but in other areas, but I'm losing faith. Let's assume that I don't want this to turn into a campaign speech. Let's assume that person, the orange one, wins the next election. Let's assume that this whole president, I'm asking myself, what can I do to empower my community? I know at New York Live Arts, we're really trying to think, how can we empower the downtown dance community? How can we empower the people in our company? How can we keep paying salaries? And also, I'm trying to with my two sisters, we're trying to start a family Zoom conversation, believe it or not. And I think that some of the young people, and maybe some of the old ones, don't quite know why we're doing that. But I feel like that is what I mean when I say the church traditionally did it, the family. My family, like many families, have gone through a lot of stuff in the last 40, 50 years. I'm hoping that we can develop a strong fabric within my family, because this is the future. I, unfortunately, Carrie, don't believe that we can only turn to the government. I don't believe the government has shown us in so many ways that it is crass, manipulative, big money. Look who's in the White House. If that is the case, I don't think I can depend on them. They don't care if I die. Therefore, where can I begin to build those coalitions on the ground? Because that's the new normal. That's the future. Who are you standing with? Now, tell me, am I?
No, and just very quickly, Bill, and then just make sure that Aletha and Carrie Mae jump in. I am not saying that the government as is, or that the government is the only thing that can respond. I'm saying it's our job as organizers, activists, this is what I do with my life, artists, to change narratives, to change who represents us on a local level, to change what government looks like. My point only is that this problem is so large that I don't think it can be solved without government. I certainly am not looking to government only, and I don't believe government solves any situation. But this situation, we need to organize, litigate, activate, create art, do whatever we can do to change the reality that we're currently facing. That's what I believe.
So then you are working along many, many different platforms, right? I mean, that is, I think, sort of like the important thing about what we do, and that we're working across multiple platforms on certain ideas and work, and build this idea about family. I think is absolutely important. I do a Sunday morning prayer with my mother, my sister, my aunt, and my daughter. It's fabulous. It's fabulous.
Mm-hmm.
But the other thing that for me again is the artist. The thing that I think about. I mean, these questions that you're raising, Bill, I think are absolutely key, and they're really important. And for me, the thing that I love about the moment, the silver lining for me about the moment is the way it actually does expose ecological disaster, environmental crisis, and the artificial, as Dr. Maybank stated earlier, right? The sort of construction of identities around nations, right? We are one nation. This virus has shown us that we are all deeply connected, right?
Mm-hmm.
No barrier between us. They are all artificial, right? And so I think of myself no longer really as an American, right? I am a citizen of the world. And one of the things that I think becomes then really important about sort of revealing what this moment is really to talk about the artificialness of borders and the necessity really ultimately to get rid of them. I mean, it's like, again, the thing that I would prefer to mine in the work, right? To sort of bring forth those kinds of critical questions about nationhood that are false, that no longer serve us, right? It simply serves power structures, imperial forces, colonialism, but it doesn't serve people in a real way. It's a false construct around sort of national identity that I think we need to sort of get rid of. And so how do we use sort of the practice of the work, or how do I use the practice in my work to sort of think about that? And of course, then there are people, the great people like, Brian Stevenson, who's doing that sort of extraordinary work that he's doing in Alabama around lynching and the prison industrial complex. Extraordinary work. And I'm not sure if you know about this group called the Marshall Plan Project, where a whole group of people have gotten together collecting data around what's going on in our prisons and how we need to sort of look at this, right? And so, as we, I guess, probably start to wind down our conversation, for me, the important thing is to sort of pose the critical questions, even Bill, like you, when I can't answer them, right? Pose them, at least have them out there. What are the real questions that we need to ask ourselves, or what is the real question that I need to ask myself now? What's the question that I need to ask myself now? And what is the question that I want to ask my audience? The people that are my audience, right? What do I want to ask them now? And I probably think that they are, again, not unlike the questions that I asked earlier in my life. What is this nature of power? What are borders? What is class? What is race? And how does it undermine the complexity of my humanity?
Jameelah and Carrie, it might be because I'm getting an email from somebody. I think I'm going to, as my dad used to say, smell hell when this is over, because that they interpreted my saying that if the orange one wins and that I'm losing faith in the government, I think people think that I'm saying don't vote. And it's just the opposite. No, just as we're clear on this conversation, I believe this is essential. And I had a very gripping conversation 2 family meetings ago with a young, beautiful as the day is long, young nieces of mine. And they are, one of them told me, my church tells us that we should be in the world, but not of the world. Therefore, we are told in our church not to vote. So that's where this is coming from right now. Those places that are supposed to be telling us, helping us, if the government doesn't. That's all. So just for the record, no, please, we must vote. Yeah.
Absolutely.
I didn't take it that way. Yes.
Yeah, I think, before this role, I worked in government for a really long time. And one of the couple things, it is absolutely critical that people vote. And so many decisions, again, rooted in where resources are, how resources are redistributed, are rooted in government. I also think that take Trump away, even with a new administration, the realities, as you laid out, Khary, is that this has been happening for years and years and years. These decisions to disinvest from neighborhoods, disinvest in public health, not understand what public health is, has happened for years and has impacted our ability to put resources in certain places, but it's also impacted our ability to really prevented us from coming together across sectors. So what Carrie Mae brought up in terms of, being without borders, from a context of a global context, I think there's that same opportunity that needs to happen across disciplines. As I sit and listen to the conversation again, and fantastic for me, as a health person to sit in a conversation with artists, but how do we make that meaningful, moving forward? How do we come together in more intentional ways and consistent ways in order to create solutions? Because I think we all have very creative, bright, novel ideas that fit, a fabric, right? A tapestry per se, that creates a better opportunity for reimagining in ways that we never thought we could, because we're intersecting with one another in ways that we never have. And so, as we move forward, how do we create that infrastructure, or if it's not an infrastructure, just simply the opportunity that we're able to come together with other disciplines than just medicine. I'm able to connect with the artists. I'm able to connect with the lawyers. I'm able to connect with the business people and the social workers and all that. I feel that that's the opportunity for us as Black people at the local level. And I do see that happening across the country in certain places. In Chicago, that Jamilah mentioned earlier, the AMA headquarters is located there. And so, they have called upon what they call West Side United. It's a collective and a collaborative that's community driven, that is actually co-leading their response for racial equity. And it's trusting upon the existing assets prior to COVID, the existing strengths within the neighborhood, of understanding what's best for them because they're in the neighborhood, but also informing government what needs to happen and where funds need to be distributed instead of the other way around. And I think the strength and power in that is because they, one, have been established for a while, but two, they have different disciplines and it's a cross-sectoral approach. They have folks who are artists, they have folks that are in healthcare and all of that. And so the ways and opportunities that we can foster that interaction more, I think will be absolutely helpful for moving and pushing the field. The other thing that I just wanted to elevate is, as a Center for Health Equity, this is a new space for the AMA. And for folks who don't know, AMA had the history of actually excluding Black physicians up until the civil rights. Yes, there you go, till civil rights. And, they issued an apology in 2008. And so, I'm on that path of what it means, to pursue justice with an institution. But one of the approaches that I think is absolutely critical, that I feel is more hopeful, as what was mentioned earlier, that to make sure we get to that, is that we are creating pathways to identify truth, reconciliation, and healing for our AMA past. So one, we need to name, as institutions that are historically white, we need to name, what we have done and what we have committed, how it has created harm, and what do we need to do in order to reconcile that. I think when it comes from the perspective of health, what a lot of folks don't realize, where a lot of power is rooted in terms of creating our healthcare system, setting up systems for insurance, is really the voice of physicians and their leading voice. But the problem and the challenge has been is that our physicians have been trained on basic and clinical science. They have not been trained on understanding and addressing the contextual nature of people's lives. So taking into account where they live, taking account what their family situations are, and being able to address that if they have food, if they have transportation, and all of these opportunities. And it presents a tremendous gap in how our systems of healthcare are actually built and public health are built. And I feel the opportunity, and as it relates to young people, I've been talking to a lot of med students who do a fantastic job at centering racial justice and health justice, which is important in a healthcare context because that is a predominantly white space. But when you can get medical students who are from all backgrounds starting to center racial and social justice, and then they're going to be the ones who are going to be reimagining, redesigning, and reconstructing systems, that's inspiring for me. And then this opportunity that I have to really push to change how physicians of the future are trained so that they do understand what racism is, the historical context, how it shows up in their own practice on a day-to-day basis is absolutely impactful and necessary. But in order for them to really be moved from a context of the emotion, they have to hear the stories, they need to be proximate. And I think that's where the connection with art and artists becomes really important and vital.
Can we address the young man in prison for a moment, please? Can we address that videotape? Is there anything you could say to us? How much truth is there in what he was saying? Is that they're trying, it is genocide and that prison populations are being forgotten. And he turned and he said, you churches, all of you people, we need you to help us. Could you, doctor, can you address what can we do about that reality?
Aletha, just before we do, because I know that Carrie has to go to another commitment. So I just thought maybe we could have a final thought from her, and then Jamilah can pull the conversation to a close, and we can respond, Bill, to your point. But I know that Carrie has to go, and I just want to give her the space for a final thought because she has to join another call. Mm-hmm. It's okay. Mm-hmm.
Oh no! Thank you all so much. I'm just I look forward to continuing the work. We have been a part of I'm not sure if I'll say community because I'm not sure if I understand completely that word, but I've known Bill for 20, 30, 35 years. And somehow or another, we always manage to come back to a touch point, right? As we move, I feel like I'm a speck of sand whirling through the universe, touching here and there as I move through. What Khary has brought together is a set of relationships that we can all draw from if we choose to, we can all build from. So we don't have a huge system of organization, but we have this one extraordinary organization that is trying to figure out ways of working with artists and doctors and writers and critics and dancers, right? Let's use Brotherhood, Sister Soul as a connector, as a space maybe where we might actually really be able to think more critically, because I think an hour or an hour and a half isn't enough time to have the level of the level of conversation that we really need to have. Maybe we'll have another conversation, a serious one, off camera, time to be able to sort of unpack some of these ideas. But yes, there is space for us to come together. I think of us, many of us, as being interdisciplinary workers working across many different platforms. And I'd certainly love to be in touch with you about the project that I am unfolding right now, Doctor. How do I aid my community in crisis? How do I use everything that I know to bring focus to it? What's the level of information that people need to know? How does that need to be presented to them in a way that they can embrace? And so I have all of my ideas. but to be able to run some of this by a qualified doctor who is at the front lines of things would be really fantastic. Bless you all. Other side of
Yes, Carrie.
Bless you, Carrie. Bless you.
Bless you, Carrie. Thank you so much, Carrie Mae Weems. Such a blessing to have you with us today.
Really wonderful. Thank you so much. So wonderful to see you. All right. Peace.
Take care. So something that I just want to mention in regards to what you raised, Bill, about the prison video and wondering how accurate is this? Is it as bad as he portrays? And I would say yes. In weeks, coronavirus has killed more prisoners than have died by execution under the death penalty in 10 years. The UCLA COVID-19 Behind Bars Data Project has been keeping track of rates of deaths and for persons that are serving time in state and federal facilities. And as of Monday, there were 341 confirmed deaths. And that's not, I think it's fair to assume that there may be more than that were not counted, perhaps because of how the death was classified. And Dr. Maybank, if you could explain how that is, how basically there are COVID-related deaths that are not being reported as COVID deaths because for any number of reasons. They were not tested prior to dying. There were other conditions at hand that were listed in the medical examiner's report as the cause of death. But could you talk about that a little bit, that we're perhaps not seeing as bleak a picture as we should be seeing because we don't always know when it is COVID, in fact, that has killed someone?
Mm-hmm.
Absolutely. I mean, I think that happens. It's happening in and outside of prisons, but especially inside. Because the reality is that there's not enough testing for everyone in across the country, just in general. Still, we're not in a space where we have enough tests. And we know initially a lot of folks, and especially folks of color, were being turned away from testing. If they didn't have, symptoms that were obvious, and some people, even if they did have some symptoms that are obvious and reporting, were still getting turned away as well. So they weren't getting tested. Children were noticing the same thing, that's happening. And there's some in New York City, we have in our hospital system now children that are hospitalized with this peculiar kind of symptoms that we're not even clear what it fully is, but we don't even know what's happened in children because they haven't been tested. And so within our prison population, that's just amplified. Those folks there have not had access to testing in the way that they've needed to have access to testing. And folks and advocates and physician advocates as well have been saying that we need to release and let go folks who have low-level offenses and don't have felony crimes that are in the spaces. And that some areas have been doing it and have been releasing it, but it's been very slow. And so now folks are just left in, and really they've been exposed because of other workers who have come in and who have brought COVID to the space. And because it spread so quickly, they've been exposed and they are at high risk for dying. And not only are they not getting testing, they're clearly not able to get treatment in the same way. They definitely aren't able to social distance. That is very clear. Masks, that's difficult and not accessible to all spaces in all prisons. So it just tremendously increases the risk. And it's just a complete violation, really, of human rights.
I mean, I think to Bill's point, Bill, you said, what of those who are incarcerated, right? What of the 2 million who are incarcerated? And again, I keep thinking of Carrie Mae's first line as we open this conversation, that something has been kind of broken and a light shined on it, right? The response to COVID can't stop with finding a vaccination, which we all hope. It can't stop from finding a treatment to the disease. The reason we're dealing with such a level of death and sickness in this country, from my perspective, is twofold. It's the horrific response from the government, which we've talked about, but the second are because of these conditions. So if we don't come out of this reimagining what our society looks like and saying no longer will 2.2 million people be in prison to experience these conditions. not how will we treat people better in prison, but how will we get literally hundreds of thousands, millions of people out of the penal system and the supervision of the state? How will we ensure that people are paid a livable wage? How will we ensure that all people have health care? Like, if we deal with those kind of issues, if we don't have people incarcerated at this level, if people are paid a livable wage, if people have health care, then the next crisis, because there will be another one, won't have the same deadly ramifications. And so we do have to use this moment, as horrific and tragic as it is, to ensure that society does not go back to the horrific nature of what we're doing currently and putting on to other humans. I mean, I think you said it beautifully, like, what is the connection to folks? And if we don't tell stories, our own stories, if you don't tell stories, if we don't create the space so those who are incarcerated can tell their stories, you know, I think, you know, I could never dance like you. I can't put together visual images like Carrie Mae Weems. My art form is the written word. And I think a lot of the power of the written word. And I think of Chinua Achebe's, you know, groundbreaking novel, Things Fall Apart. And the line is, and it's about colonialism, but I also think it's about COVID. It's about racism. It's about everything that we face. But his context was colonialism. He said that the colonialists came and took a knife and put it to what connected us, and things fell apart. And so when we think about that, our society right now has fallen apart in many ways and revealed what Carrie Mae talked about at the beginning. And the question now really, to me, is how we all put it back together.
Amen. Amen.
So I know we've gone over time a little bit, but that's a good thing. Before we close this out, I would like for each of you to briefly reflect on what that reimagination looks like for you. So what are the changes that we can make? What are the things that we can and must do differently to repair that togetherness? And in certain places, create a togetherness that's never existed. And can we, if we want to start with you, Bill?
Yes, our position at New York Live Arts, and it's more every day, couple of hundred artists get together, support and pay artists, stay engaged in a civic conversation, gather data and prepare for a number of scenarios, always focusing on rigor, safety, best practices, our mission, while focusing on how best to survive and come out on the other side of this in a vibrant and healthy way.
Beautiful. Thank you. Dr. Maybank?
Yes, I think some of it I mentioned before. I think it's important that we find the opportunities that we are able to connect across disciplines in more intentional ways. I'm speaking from the health side, healthcare lens and public health lens. The reality is that we are in our silo of health and healthcare. And I think, as Khary said earlier, we know health is political. We know that our participation in democracy and voting is absolutely critical into what creates the conditions of health in this country. But we are not the only ones who create health, and that means we need to be in partnership with all those other folks who also have a stake in it. I think as well, you know, as an organization that we have this opportunity to advocate in bigger ways and to advocate for at the federal level for policies that are more rooted into reimagining the system. And they're not just transactional. They are policies that are advocating for a livable wage. You know, we have that level of power in DC. There are policies that are advocating for more money for the public health infrastructure, advocating around incarceration and justice around the incarceration system, things where health has not typically advocated in. I feel like there's a tremendous opportunity and a need, not even just an opportunity, an actual critical need that health moves beyond its walls of the healthcare system and advocates more upstream to the social and structural context of health, of what we know creates the conditions of where we can actually have good and optimal health.
And Khary?
So I would make 2 points, I think, on the very specific to my work. You know, Brotherhood Sister Soul will continue to do the necessary work to support our young people and create spaces for them to become activists and social change makers every movement in this country that's created change has been led by young people. So I encourage folks to go to our website, brotherhood-sistersoul.org, and check out our work. I think that day-to-day work is linked to this larger issue. I mean, I believe in a nutshell, Jameelah, it's movement time, you know? I mean, we are talking about several things that are interconnected, that we need to break through silos around this work. You know, as Aletha is saying, you know, we need a livable wage. We need to completely deconstruct the prison system. You know, we need healthcare for all. We need voting rights protected. We need to ensure that all in this country have access to education of a high level. These are the issues Bro Sis works on every day for our population. But I do think that it is movement time. It is time for us to demand, work towards, organize, create art, agitate, litigate. There's never been movements without young people in the lead and without dope songs and dope art and style. Like, they always go together. So there's no reason that this conversation can't be the kind of thematic intersection that's so important going forward, and the interconnection of policy and litigation and organizing and art. We need all of it.
Well, with that, I want to thank all of you, Carrie Mae Weems, Dr. Aletha Maybank, Bill T. Jones, and Khary Lazarre-White for your phenomenal gift of words, inspiration, and food for thought today, for making time in between your many Zoom calls to talk to our people in this moment. And hopefully this will be but one of many of such gatherings of the minds during this time period. I think if nothing else, you know, there's the organization Girl Trek hosted a live conversation last week between Angela Davis and Nikki Giovanni. And it really gave me pause. And I wasn't able to watch it live, but what really gave me pause about it was the number of people who would never have access to those two people in dialogue that could, because we've been forced outside of our museums and outside of the academy and outside of the spaces in which we typically gather to share some of these ideas. And so there's something really beautiful about democratizing information that's also central to who we are as a people and how our artists and thinkers typically have operated, you know, in our own spaces. So now we can bring this into the living rooms, into the break rooms, and where our people are, so they can have this information and be inspired and move forward as well. So I'm grateful for that. I'm grateful to each of you, and I'm grateful to NewsOne for hosting this platform today. Thank you to everyone on the NewsOne team. And thank you again to the Brotherhood Sister Soul. Please follow and support their work. You can learn more about them. You can donate at Brotherhood-Sistersoul, SOL.org. There's a link to the organization in the chat thread of the Facebook Live. My name is Jamilah Lemieux. I thank you all again for joining us this afternoon, and wishing you all the peace, comfort, and joy that you can summon right now.
Thank you, Jamilah. Thank you.
Thank you, Jamilah.